Hi, my name is Rebecca Andriano, and today I'm going to be giving you a parent perspective to the sensory integration therapy. My son's almost 4 now, and when he was about 2.5, he was diagnosed with sensory processing disorder. So I've gotten to witness and experience kind of firsthand what sensory integration therapy looks like. And we kind of knew something was off when he was unable to wear shoes or socks. Most clothes bothered him. He just seemed like his touch system was constantly on alert and kind of hypersensitive. And because of this, there were a lot of tantrums and meltdowns that were related to this problem. So we took him to the pediatrician, who recommended him to occupational therapist, who then recommended sensory integration therapy. And at the time, I didn't know much about the different types of therapy. I was teaching in the classroom, so I hadn't started my program in an ABA yet. So it was all kind of a new experience for me. So we put him in the occupational therapy, and we really just did not see any gains. And in fact, some behaviors even got worse, and there just nothing positive was seeming to come out of it. After a few weeks in the therapy, she did recommend something we could do at home, which was a brushing technique, where we would brush his arms and legs and back and hands and feet every 2 hours, and then do joint compressions. And we found that if we did this, after about a week and a half, he started wearing socks and shoes. Some of the tantrums were minimized, and so we did see some behaviors getting better, and he was at least wearing socks and shoes and things that we wanted to see happening. But the actual therapy in the room that we would go to once a week just did not seem to be doing anything. So eventually we pulled him out of that. And so as a parent, I did not find sensory integration therapy to be effective. And as a matter of fact, when I started the ABA program, I learned a few techniques, and I actually tried those at home. I kind of changed the way I did some things at home based off of what I was learning in my classes, and those made more of a change in his behaviors than the sensory integration therapy ever did. So right now there is just no evidence to support sensory integration, and because of that, it's not ethical for a behavioral analyst to use this in their interventions, because according to our ethical code 2.10, we should be looking for effective treatments that have scientific support, which this does not. There's another ethical code, the first one, 1.01, which says we should rely on scientific knowledge to base our interventions off of, and there's no scientific knowledge that goes with sensory integration right now. Also, we are not trained in sensory integration, so that's against the ethical code 1.02, which is the competence factor. And so if we're not trained in it, we should not be using it in our treatments. So as of right now, there's just not enough data to support using a sensory integration approach to therapy. And I read an article by Miller, Cole, and Schoen, and it was called A Randomized Control Study of the Effectiveness of Occupational Therapy for Children with Sensory Processing Disorder. And this article brought up an important point that right now, most pediatric occupational therapists, their entire practice is based off of this approach. And so right now, there's a widespread use of sensory integration therapies. And so we're spending a lot of money and time on these therapies. So we really need to kind of focus on getting that data and to support this treatment if we're going to be using it as much as we are, just in general. So the article really brought up some good points about really kind of getting the ball rolling with getting some more data out there. There is some data that shows that this is effective, but there's just not enough. There's not enough reliable data to make it an effective treatment at this moment. And just because it didn't work for my son doesn't mean it can't work for any children, but just our experience in particular was not a positive one with this type of therapy. So thanks for watching.